We're streaming live.
Hi, good afternoon, everybody. So, I'm Dr. Seema Sharma, and we are going to be talking about cervical cancer as this is our Cervical Cancer Prevention Month. Thank you so much for joining in. Shows as parents you care for your children and you want to be informed. And I'm really delighted to be here as your guiding doctor. And being a parent myself, I understand that it is very important that we give the best outcome in terms of health to our children. So, I am going to be talking about cervical cancer. Some of you would know about cervix, but by and large, I would want to just give you a reassessment because when I talk to my patients about cervix, a lot of people assume it is the cervical spondylosis or the cervix of or the cancer of the rib cage or the vertebra that I'm talking about. So, for everybody to be on the same page, I would like to share that cervix is actually the entry of the uterus or the womb. This special area of the uterus is called cervix. I don't know if you can see my cursor, but cervical cancer is a very, very common cancer in our society. And a lot of people, lot of parents, lot of, people in general in society don't want to talk about cervix because it is considered an intimate part, and people will just say, oh, she had cancer of the uterus. Even children would not know. A lot of patients come to me and they say my mother had cancer of the uterus, but uterus is actually different from cervix, and the risk factors of uterine cancers are different from the cervical cancer. So it is very important that us parents understand that cervical cancer has its origin in young age and it is a totally preventable cancer. So it is shameful that when we know that we can prevent this cancer and we don't. So this is located deep inside the vagina, and this cancer is almost as common in our country as breast cancer. Though everybody talks about breast cancer, people are worried about breast cancer, people are not so much worried about cervical cancer. So please understand that this cervix is not our neck area cervix, or no, it's not cervical spondylosis we are talking about. It is the entry to the uterus we are talking about. So what? So this cancer has its origin, I reiterate, in young age when girls start sexual activity. So we would be talking in details about why this happens, but on an average, this is caused by a germ called HPV. It is called human papilloma virus. This is the short form. H means human, P is papilloma, V is for virus. It is a virus, something like coronavirus. And now, how does it come into a body? It comes from skin to skin contact, like, when young girls or when women get married, everybody gets married and have sexual contact with their husbands, with other partners. So, sexual contact can spread this virus. This includes sexual intercourse, like vaginal intercourse. It can also spread through oral sex. It can also spread through anal sex or any other contact like finger to genitals or any other way of contact into the genital area. And please be informed that viruses are very, very small in size, and condoms are important to prevent, but they do not offer complete protection from HPV infection. They will help you with some kind of bacterial infections, they will help you with bigger STIs, but viruses are very, very small and they can escape a condom very easily. So they are good to prevent lot of sexually transmitted infections. They will not give us complete protection from HPV infection. So this HPV virus is one of the main sources of getting the cancer. This virus one can get from their husbands, from their sexual partners, and like you can see that once this virus enters our system, this gets attached to the cells in the cervix, continues to multiply there, and it starts to create damage. And this damage eventually will cause the cervical cancer, right? like I just said, that people can get infected with HPV when a woman's, like we are talking about a woman here because cervix is only in women, so their genitals would touch the penises or secretions of people who have HPV. So essentially, if you even look at a woman who is not having any sexual contacts before marriage, she just has a partner or a husband who has had sex with people before and he already has an HPV virus, somehow it has a tendency to affect women more than it can affect men. So in that is the reason why the cervical cancer is very very high in our society, where men don't get penile cancer so often. So somehow this virus is biased because it has been seen that male secretions can stay into a woman for a longer time. That's why the virus gets more time to damage a woman's body. So this once this virus enters through oral, vaginal, or anal sex, it can stay inside the system. So who's at risk? Is your child at risk, or are you at risk? All the young mothers who are looking at this, well, every woman who would have some kind of sexual contact sometime in her life is at risk. Clearly, anybody who gets married would have some sex. She is at risk. But obviously, the exposure risk will increase the higher the number of sexual partner a person has, right? Also, if you are monogamous, you have only one partner, but your partner has had sex with people in the past, it will increase your risk because there is a higher chance that even your partner will have this virus inside his system. And it is estimated that almost three-fourths of sexually active women will have one episode of HPV infection before the age of 50. It is so high, it's so highly rampant in our society that 8 out of 10 people, 8 out of 10 women, married women who have no sex with any other partner, would still have HPV infection. So that means your exposure is there. It is something like Omicron. It is affecting everybody, but few people are developing symptoms, some are not developing symptoms. So that means you are left to fend for yourself. So your body immunity has to take care of getting your body rid of the HPV virus. And it has been seen that majority of the individuals would get affected very soon in life. Young girls between 15 to 25 years. These are not Indian data. This is Western country data because they are more prompt in doing all the researches. So people get affected and exposed to young age, and now we know that sexual promiscuity is increasing. People are experimenting at a younger age. So essentially assume that all our children are at risk of getting HPV virus. So what do we do to help them? That is the mainstay of today's talk. So how does a person know that she is infected? Well, as I just said, that this virus would sneak into your system. So unlike coronavirus, which will give you a cough or which will give you a bad throat or fever, HPV does not give you many symptoms. And majority of the times, this virus sits into our body for a long time. It just sits for 10, 15 years. Most of the times our body immunity can throw it out, but sometimes it may not help. So in 10 to 20% of all the women who are exposed, this virus will not go away. So these people who basically have HPV in their system for a long time and are at high risk of developing this cancer. And the good point about this thing is, once the virus is in your system, it has to be there for 10 to 15 years. That's a huge long time that after that it can give rise to a cancer. So one has to kind of ignore this virus for 15 years so that she gets affected, and still this virus is so rampant and the cervical cancer is so high in our society. It is shocking that how as parents we don't take care of our children, or as women we don't visit our gynecologist for years and years and years, because this virus can be very simply diagnosed. Like we can diagnose Omicron, like we can diagnose coronavirus in our system, we can also diagnose an HPV infection with a very simple test. But most of the people don't even come for that test ever in their lives. So it is important to not only have this testing done, but to also take precaution that this virus never even enters our system. So for that, we have injections available. Worldwide, three types of injections are available, which I will just talk about in our subsequent slides. The names are mentioned here. The names are like Cervarix, Gardasil, and the newer vaccine is Gardasil 9. In India, all the three types are now available. You can ask your gynecologist. Cervarix is of the three cheapest, but it also covers two viruses. Gardasil covers four, and Gardasil 9 covers nine types of virus, HPV types. So we were talking about the HPV virus. So a little bit more on that. What is this virus? There is many subtypes. Like we keep coming across of the Omicron variant. We have the Delta variant. Before that, we had the Alpha variant. So these are all basically subtypes of the coronavirus. So similar to that, we have around 100 different subtypes of HPV. Now, some of them are more potent. Like with Delta, many people died. With Omicron, not many people are dying. So Omicron is a milder variant. So similar to that, we have low risk HPV like 6 and 11 number, which causes only genital warts. Now, genital warts are extremely common in youngsters. They are present anywhere, it can be present anywhere in the body, but when they are present in the genital areas near the anus, near the vagina, they can increase your risk of cancer. And then, of course, there is the high risk types, the 16, 18, which are giving rise to 70% of cervical cancers. Then there are types 31, 30. These are only numbers, but sometimes when we do the testing, we can find out what type you are infected with. So we can categorize HPV into the low risk or the high risk type. So it is the high risk, which is more, if it is present inside your system, has more tendency to give rise to cervical cancer. So what is this vaccine? Vaccine, of course, like we are all getting tested, we're getting vaccinated for COVID-19. Why do we take this vaccine? Because we want to not have the coronavirus. So once we say we have a coronavirus, vaccine may not help you too much. But similar to that, we have the HPV vaccine, which really would help the girls to avoid getting infected from HPV. And it can prevent serious or deadly infections. And this vaccine can help us to basically fight the germs that can cause us cervical cancer. Now, this injection, similar to the COVID vaccine, has to be given in the upper arm. How many doses a person needs depends on how much is the age of the girl. Less than 15, she is a normal person, doesn't have any problems. She needs only 2 injections 6 months apart once in her lifetime. So if your daughter is less than 15 years, she only needs 2 injections, which is a very good thing, because it is going to cause her less pain. It will also save you a lot of money, because these injections are expensive. If she is more than 15 and she is normal person, doesn't have any issues with her immune system, any person who's more than 15 would require 3 injections at 0, 2 and 6 months apart. Your doctor will tell you the dosage schedule. Or if there is a problem in the person, if some girl or a man even has HIV, or he or she is immunocompromised, we would need 3 injections regardless of age. Right? So most of the parents here that I can see are logged in. They have younger children at home. So if they're your daughter or even your son who's less than 15 can get these injections, 2 injections at least 6 months apart. And these injections give you maximum protection if your daughter has not yet become sexually active. See, youngsters are really experimenting with the sexual activity and very early, and not all the times we as parents are aware of what is happening in our child's life, which is okay. As parents, it is important to see that our daughters don't get sexually transmitted infections, and to keep her safe, we need to give her whatever medicines or whatever injections that are required for her. So the important thing is that these injections they will not help you to get rid of HPV. So once the virus is inside the system, the virus will stay there. But since there are many subtypes, 100 subtypes, like I just mentioned in my previous slide. So if somebody has, say, 16 type, So this vaccine will still protect her against 18 subtype or against 31 subtype or against 33 subtype. So irrespective of the infection, it will still help. But the best protection comes if you give vaccination before she becomes sexually active. Even if, like you are, because this vaccine is actually approved between 9 years to 25 years. So we say more than 26 because we assume almost everybody becomes sexually active by 26. So if you're like more than 26 and you have been sexually active, you've had genital warts, you've had positive HPV also, there would still be smaller benefit from the HPV vaccine. Only thing is, yeah, it's expensive. It might give little lesser protection, but still it is of benefit. And FDA actually approves this till the age of 45. So anybody who is still 45 years of age from 9 years onwards can take this vaccine. So all the mothers who are watching this, you can take it you can take it yourself. If you're less than 45, protect yourself with whatever benefit you will get. And also, if your daughters are more than 9 years of age, you should definitely consider vaccinating them to help them not get cervical cancer when they're little older. So why should you get the vaccine? I just said that it will basically not only help you from getting cervical cancer, it also, now research tells us, it also helps us against anal cancers and also part of head and neck cancers. And it saves boys from penis cancers and anal cancers. See, in society, we don't really hear about these cancers in boys and also in women, because somehow these are private parts. Women don't talk about it, families don't talk about it. They will just say, oh, she had a spread out cancer, she had like I said, she had cancer of the uterus, because it seems little easier to communicate with the rest of the people without having raised eyebrows that, oh my god, cervical cancer and other. So people don't talk about it, but they do happen. And as doctors, we see them happening almost every second day. They are very, very common cancers. That's why as doctors, we want to spread the knowledge that please come and get vaccinated. And see, Australia is also vaccinating all its boys, because there the penile cancers are very high. In India, it is not yet a routine recommendation to vaccinate boys, but people who can afford it, you can definitely ask for it. And the sooner you vaccinate your boys, the higher is the safety for them also, because HPV can not only spread from men to women, it can otherwise also, it can spread from women to men also, though there is a much higher transmission from men to women. So most people who have, but it's important to remember that you should not really truly get very scared, because most people would not have cancers, but some of them would have cancers. But it is very hard for us as doctors, as people, to understand who will get cancer and who will not get a cancer. So it is a good way, the vaccine is a very good way to prevent getting infected in the first place, right? Now, is the vaccine safe? We asked the same question about all vaccines. We had a lot of queries when the COVID vaccine was being launched, and eventually we have seen that it is protective, it is safe in the longer run. And all the studies, we've been now vaccinating for this virus for almost 20 years now, and all the available studies have clearly shown that they are very, very safe. Only when you are getting them yourself vaccinated or your child vaccinated, expect that there would be slight amount of pain or redness, or your arm might hurt for a few days. It is extremely safe, and we have here the chart which tells us that it does save almost 75% of cancers of the cervix. And the different ranges are here, and anus, here you see anal cancers are again very common. They save almost 80% of anal cancers in women and in also men, and on an average 50% of penile cancers. As whatever be the studies in India or anywhere, statistics may vary little bit according to the country. Every country has one cancer which is predominating over the others. The important thing is it is giving you benefit by bringing your percentage of affection down. Also, it reduces the risk of genital warts from women to men if you vaccinate the girls, and if you vaccinate your boys, it does reduce the chances of transmission to your daughter-in-laws or all the sexual partners your son may have. Um, I think we would skip this slide. Like we've also said that this one injection, like the COVID vaccine, saves you only for the COVID virus. Here, and this virus is not even giving rise to any cancers. This HPV vaccine is the only type of cancer which is effective against any kind of cancers. A lot of people tell me, "Ma'am, is this also useful for breast? Is there a breast cancer injection also?" Well, no. At the moment, there is no protective vaccine against breast cancer. This is the only vaccine that we talk about. And this vaccine can help us against cervical cancer, vaginal cancers, vulval cancers, anal cancers, penile cancers, and also part of head and neck cancers. All those viruses which are responsible for causing these cancers can be helped by taking this one single vaccine. Another question a lot of people ask me is, will it help me against other sexually transmitted infections like chlamydia, gonorrhea, herpes, anything else? Well, the answer is no. I told you that this is specific for HPV virus, and since HPV virus, you know, is responsible for causing cervical cancer, we are talking essentially in terms of prevention of death by cervical cancer. For other type of sexually transmitted infections, women have to use protection like a condom all the time. So now let's talk about what are the different types of vaccines available. So we have three different types. We need to give them shots. In our country, like I said, all three types are available. And we mentioned it in the previous slide that people younger than 15 should get 2 doses, and 15 and older should get 3 doses in a period of 6 months. It is required only once in the lifetime. It is lasting protection. So once you take it, even at the age of 15, and you live till the age of 85, at the moment, whatever research says is that it will protect you till the age of 85. So fantastic, 2 doses going to just take care of so many cancers once for all. So a good idea is to start when your girls are 11 or 12, but you can actually start as early as 9 years of age. Best time to vaccinate is between 9 to 26 years of age. Once you are pregnant, please tell your doctor that you should not take the vaccine, though there has been no side effect found, but still at the moment we are avoiding in pregnant patients. And it works best when girls have not yet started sexual activity. Once they start sexual activity, and God forbids they get exposed to HPV, which I said almost 80% women will get exposed, there is nothing much that we can do, but it still would give you some protection. But again, I reiterate that it is best to have and start the vaccination before sexual activity starts for the first time. And any side effects that we can expect is whatever any common vaccine says, like redness or swelling. Some people I have seen, they become because of pain, they kind of, for a second, they feel they are fainting. So it is always better to have this injection lying down, or at least have a place where you can lie down for a second after taking the vaccine. So for 2-3 minutes, some people, like for any other injection, you need to just be careful that you don't fall over. So does it always work? Is the next question, because these are expensive vaccines. It works very well. We don't have anything which is like 100%, because there are almost 100 subtypes. So at the moment, we are providing protection up to 9 to 10 against 8-9 main subtypes. Well, if you have a cancer from those 8-9, it'll work. But if you have it from that, say, 10th type, which is not yet covered by your vaccine, you are unlucky. But then it is extremely efficient vaccine. It is something like, even despite COVID vaccine, some people did get COVID last time, and some people even died despite vaccine. So, but majority of the people who had taken vaccine had milder disease. So similar to that, the HPV vaccine almost always works. But even if it is not 100%, it will lower your risk for other types of cancers also. And of course, there is always a protective behavior. People who are careful about getting vaccines, they always also careful about their own health. They will follow protection, they will follow hygiene methods. So it has been seen that virus gives almost very efficient, more than 90% effectiveness against cervical cancer. So do we need to check for cervical cancer if you get the vaccine? Yes, because I said it is not 100%. You still need to go for your regular screening with your gynecologist. Get your pap smear done at least once in 5 years if you are a normal person. And it is recommended that we start pap smears at the age of 25. Do it every 5 years till the age of 65 years. Very important to at least have a regular checkup done, because if something is developing, your gynecologist can catch it at an early stage. And if you really even have a cervical cancer developing on an early stage, we can give you treatment in OPD only. And otherwise, if you let it grow and come to somebody who, when you develop symptoms like offensive discharge, unnecessary bleeding, or bleeding after having sex, so those are late symptoms. And if those happen, you need a uterus removal, you need chemotherapy, radiotherapy. So, as we say, a stitch in time is definitely better. So if you would have just 2 injections, give it to your daughters in time before they actually start sexual activity, and then you are really giving them a huge gift of life. Because youngsters, would basically need to be told by their parents to take this injection. No youngster would ever come forward and say, auntie, I want this injection, because obviously who wants pain? And at a younger age, girls don't realize how important it is for them to take this injection. So all those parents who are listening to it, please ensure that your daughters, and if you can afford, even your boys, should have this vaccine. And have regular checkup yourself, at least, if not very regularly. If you can go once a year, fantastic, but at least once in 5 years, get a pap smear done and a HPV test done once in your lifetime, to kind of save yourself from cervical cancer. So, well, that's about it. I hope I have given you enough information. If you still have more queries, we are open for discussion, and we would be now taking your questions. Akul, are you there? So, well, this is about me, and uh, our clinic is in Rajouri Garden, and we would also be offering some discounts on this vaccination, just to give you more encouragement. And if there are any questions.
So we don't have any questions as of now on the live stream.
Mm-hmm.
We can wait for a little bit,
Okay.
but I think there are no questions for now.
Okay. So, well, really, I think I would again request all the parents who are listening to not delay and have your young girls vaccinated and give them the gift of life. We are celebrating this cervical cancer protection month, from all the doctors, all the gynecologists. We wish you a safe and happy life. So do protect yourself. And that's about for today.
There is one small question. If you could share the cost of the vaccine.
Well, the vaccine is, as I said, the 3 different types of vaccines available. The Gardasil approximately is around 2,500 per dose. Little bit extra, of course, plus minus 200-300. It keeps varying. The Gardasil, which is protective against 4 viruses, is approximately 3,700 rupees per dose. And the nanovalent Gardasil, which is like Gardasil 9, is approximately 11,000 rupees a dose. For all three, 2 doses for young girls and 3 doses for adults is what is recommended once in your lifetime. And in different countries, different vaccines are available. Like in India, we have all three vaccines available because people have to pay from their pocket, and depending on whatever you can afford. But higher the cost, higher is the effectiveness. And in UK and US, we have only Gardasil 9, which is now being given, because essentially that covers 9 viruses and that gives you the best protection. So if you can afford, you should go for that. So anything else? Any other questions? So, well, I don't see any more questions. Thank you so much for your patient listening. So, again, I would kind of re-emphasize that if you vaccinate your girls early, you can save a lot of money in terms of saving the cost for one whole vaccine and give them better protection. But do vaccinate whichever your finances can allow you. Do vaccinate your daughters with 2 doses of cervical cancer vaccine, and come for regular checks to your gynecologist yourself. Thank you so much. That's all for today. Bye bye.